Good day, podcast community. PeteKane here, community coach, podcaster, and author. And we have a special guest on the show. Whenever somebody is making health a priority, we love having those guests on our show. So, Nicole, tell our viewers who you are, what you do, and who you serve, and then we'll get into the podcast.
Great. Yes. So I'm Dr. Nicole Forte. I am currently a chiropractor and an athletic trainer, actually. I love serving, individuals that love to, well, first off, just want to stay healthy.
Mhm.
Um, I definitely kind of go more into the athletic side of things or the active individuals. So the ones, like gym goers, the weekend warriors, athletes, those are the people that I typically like to serve. But I definitely see, the pickleballers, the individuals that, are struggling with walking, things like anything that, they just want to keep staying active the longer they can. So that's kind of where I like to go with that.
Awesome. Now, tell me a little bit about how did you get interested in chiropractic care?
So it's kind of not the normal story, I think. Um,
Mhm.
so in high school, I always wanted to be an athletic trainer. I knew that from a young age. So that was kind of my set story. And then in high school, I had friends come to me to, adjust their back before games and things. I had never previously seen a chiropractor at that point. So I kind of just did what I knew how to do. And then a friend of mine in high school actually told me, she's like, Nicole, why don't you become a chiropractor? And before that, I had never really known what a chiropractor did or what they were. So I did some research. And that was about my senior year in high school. And I was like, you know what, that is kind of something I'm interested in. So went off to college, kind of planned on doing athletic training and a track for chiropractic care. Um, and then, after I graduated my undergrad, I went off to chiropractic school and just kind of continued that route. So that's kind of how I got
What
into it.
what are when you talk about athletic training and
Mhm.
yeah, there's that weekend warrior. What injuries or what things do you see the most happening in chiropractic care of the people that come to see you?
Okay, yeah, typically I feel like I've been seeing a lot more of like shoulder injuries.
Hmm.
Like I said with the pickleballers, they're getting back into being, active and things like that, and they're having a lot more shoulder injuries. Um, Another one might be, obviously we typically see a lot of the neck soreness from sitting at a desk or just hunched over a lot throughout the day, so a lot of neck pain, and then I've been getting a lot of sciatic pain, which is just the pain in the low back that can shoot down the leg and things like that.
Hmm.
So those are typically the 3 that I feel like I see a lot of the most.
You know, this was years ago. My youngest, who's now 35, she got adjusted immediately after birth.
Mhm.
And so we've always believed in chiropractic care. And you hear the old thing about crack your back and it's back stuff. Talk to us about the holistic approach that you have with what you do to improve people's health.
Yeah. Yeah. So, like you just said, most people just think it's getting your back adjusted and then you get sent on your way. Chiropractic care is truly a nervous system kind of reset a little bit. So your spinal canal goes through your spine. And so that's kind of what we're dealing with here. And so when you have interference through restricted motion, is what we like to call it. So, you can't turn one way or bend over right. You start to get restricted in that area. When we come through with those adjustments and soft tissue work through muscle work and things like that, we help restore that motion. And
Mhm.
therefore, it helps the spinal cord be able to transmit, the signals it needs to throughout the body. So that way the body can actually function the way that it was supposed to all along. So we're really just removing like the interference that some of those restrictions are causing in the body so that your body can do what it was made to do all along.
Yeah, that's the approach, in the past has always been throw a pill at something and,
Mhm.
and get some relief. But, it's like putting a Band-Aid on a wound that you got to let it heal. You got to let it do other things. When you look at the what we're faced with right now, a healthcare crisis, where do you think you have been able to fit in and get solutions to with the approach that you take?
Good question. Um, I've had quite a few people come to me and they just like straight up, I don't want surgery. I don't want, I don't want to have to take a pill for pain. Um, and so I think there's more and more people turning to care that really focuses on helping the person get through and like actually fix, the root cause instead of it's something just like over and over again happening. So I think chiropractic care is becoming a little bit more important in that aspect, and I think that we have been able to help clients and patients decrease their pain and improve their lifestyle without having to, take a lot of medication or get cut open, when they don't want to.
Hmm.
So that's been important to see, and the more people you help in that aspect, the more they're going to go tell, friends and family, and
Yes.
they're gonna start trying those holistic approaches as well, I think, so.
Do you feel that there is anything misunderstood about chiropractic care that you could share with our community?
Mm, yes. So kinda like we talked earlier, I think just the whole approach of there's so many videos out there about chiropractic care and, like, the negative, I would say, effects of it, where they just see someone getting, cranked on or adjusted really hard.
Mhm.
Um I guess, like, the approach I like to take, and I know a lot of other chiropractors do, it's kind of a whole body approach of it's not just adjustments. Yes, we do definitely do adjustments, but we can do soft tissue work. So, we work on your muscles. We can work on, um, getting your body. How do I want to say this? It's not just one thing. There's definitely many,
Yeah.
many techniques that we can do. And that's the other thing is, there not one technique is going to fit for one person. So we have, one person may not like to be adjusted in the neck. I know a lot of people don't like that. So there's other techniques of, the activator or manual techniques with just your hands, like softer muscle
Mhm.
work that can help. And so I think just understanding, what chiropractic care does through the nervous system, but also all the techniques that can be used and can be changed up per person that you have coming in.
Mhm.
So it's, customized to that patient.
That's awesome. We're born to create. How does Nicole create on a daily basis?
Mm, how do I create on a daily basis? Mm,
Well, let me
get,
give you a little
I say
context.
maybe I need a little, yeah.
Yeah. So we watch the Americans, 4 hours of
Hmm.
TV, scroll 2.5 hours of TikTok videos, and we're consuming
Okay.
other people's lives.
Yes.
To create our life, how does Nicole keep creating that really honors our future self when we do that? What sort of thing could you share with our community?
Mm. I think like in a position where I am like in the health community and stuff, just continuously consuming, you know, evidence-based material, so like I'm currently taking other classes right now to further my education and like we call it corrective exercise specialist. So being
Mhm.
able to, help people in that aspect or nutrition. There's many avenues you can take, but for someone in the health industry, I think continuously making sure you're staying updated on the current research and just making sure that you're understanding where your profession is going and trying to stay on top of understanding, what you're actually teaching your patients and doing with them and
Hmm.
having that knowledge.
Yeah, that's wonderful. I was at a Rotary up in Alpharetta, and a friend of mine who spoke at our live events, he lives up in that area and wanted to be involved. There was a gentleman that spoke on peptides, and it was the
Hmm.
second time I've heard a person speak on that. Is there anything coming into the mainstream of what you do that people are like starting to get familiar with? I had never heard of it 6 months ago. Now I seem to hear it quite often. Is there anything that you can share with our viewers?
Mm. I feel like I mean, I have heard of the peptides thing. I actually have had patients talk to me about peptides, but I'm currently not adversed in that, lifestyle. So maybe that's something I'll have to get into. But through chiropractic care, I feel like some of the modalities we use,
Mhm,
meaning like cold laser or shockwave therapy. Those have
mhm,
been around for a while, but I feel like more people are coming to us and asking about those things, and asking, what they do and how they're helping. And so that's been interesting because like I said, we've been dealing with it for a while now. Like we've been, telling patients about it or using it on our patients.
mhm,
But I think the research is coming out more and more about how helpful it really is for, certain clientele. And
mhm.
I think that's been interesting because it's definitely a good tool to use if you're able and have it available.
Yeah, the world's changing very rapidly. If you would have told me 4 years ago, 5 years ago, that I would have been into meditation and journaling, I would have
Hmm.
told you you're crazy. But I do those every single day.
Yeah.
How do you recharge your batteries? What does Nicole do that really honors your personal health?
Yeah, absolutely. Definitely a few things. The biggest one for me is my faith.
Mhm,
I like to read my Bible. I try to read it daily, you know.
mhm.
I like to listen to worship music in the car, or just different kinds of music like that, which definitely
Mhm.
helps when you're getting angry with the Atlanta traffic. Kind of sets the tone.
Yes.
And I definitely, and then the other side of it, I love working out. I still play recreational sports. So I stay
Mhm,
busy with that. But so both like the physical and spiritual side definitely help keep me recharged. And then,
mhm.
just time with family and friends, just I'm a social person most of the time.
Yeah.
So that's definitely helpful for me.
Yeah, I never realized I was an introvert and an extrovert, and I have to have
Yes.
times to recharge those batteries because when I'm out too much, I find myself, I can tell when that happens.
Hmm.
Is there anything you do that helps recharge those batteries besides your faith? And I
Hmm.
am the same. I'm same thing. I believe strongly in my faith journey, but is there anything physically you do to really keep Nicole on her, energized and keep Nicole her batteries recharged?
Physically, yeah, I would say the working out definitely helps. Going
Mhm,
on walks, just leisurely walks, not necessarily anything too crazy. The sports that I'm involved with, all those things are physically, but also getting enough sleep. I can't preface that enough. Like, if I don't get my 7 to 8 hours, I know that I'm definitely struggling, the next day, the next
mhm.
few days. And sleep just affects so much. So those things definitely.
Yes.
And then eating healthy has been a huge thing too. I like to
Mhm,
meal prep, so just making sure I have all my meals and I'm getting enough protein throughout the day and
mhm.
um, just staying well fed throughout the day keeps you, mentally being able to engage with people and, be able to just keep going throughout your day.
Yes. AI is changing everything we do. How are you
Mhm.
using AI in your practice that you could share with our viewers?
Yeah, that's a good one. I like to use it honestly to make up like exercise programs. So it's like
Mhm,
I already know how to like, sometimes if it's like a shoulder thing and I just want a quick little like 6 week program, but I don't want to have to like write it all out myself, I'll get that from AI, and then I'll kind of take things that I already like that are they've already been doing, or I, want to switch it up and maybe mix it up in the mix. But, it's nice to have the knowledge of what you want, but not having to write it all out. So I really like that for, some of my exercise programs that I give out. Um, and honestly, I'd say that's probably the main thing I use it for right
Mhm.
now. But it's definitely becoming popular, so I could definitely use it in the future for some other reason I don't know yet. But
Yeah, we my partner, he lives up in Canada, and this was for almost 4.5 years ago, and he kept telling me like, "How are you using AI in your business?" And I said, "I don't have time for that stuff." And then I had that AI moment when I was putting together a training, a program, an actual course that we
Mhm,
have putting together, and literally it created a framework and really the infrastructure in like 10 minutes, 5 minutes. And it would have taken me 6 months to a year or longer before.
mhm.
But it was kind of like once I saw that, I nearly fell out of my chair, how much it gave me so I could focus on higher things. I mean, putting my voice to it and doing all that stuff. But it gave me the framework that I just couldn't believe it did it so fast.
Yeah.
Do you feel like learning? So, are books or podcasts? How does Nicole learn to get better?
Yeah, I would definitely say right now it's been through my classes, so that'd be more textbook learning.
Mhm.
But I have podcasts saved that I would like to get to, and just kinda see, how other people do things and what they're
Mhm.
doing. But in all honesty, I would say I'm a visual learner. I'm like a
Mhm.
hands-on learner. So, like, going to, like, CEU courses where you actually have, like, laboratory work where you go in and you get your hands on other patients, and you practice on each other and do different things like that and learn different techniques. That's definitely probably the best way for me to learn something, or
Mhm.
just seeing another doctor do, something in front of me and teach me that way. So,
That's good. You know, having mentors, coaches, and people that assist us is so important. Is there a person that came alongside of Nicole earlier that helped you grow personally?
mm, more like in chiropractic care or just in
Yeah,
general?
or teacher, anybody in general that kind of said, took Nicole under the wing and just helped you to really move forward.
Can I move forward? Yeah, definitely. I mean, just kind of personally, I would say my mom has definitely been there for me, supporting
Mhm.
me, always there for asking questions. So that's a personal side of that. In the chiropractic world or in, my business side, um, I would say right now in the last year and a half that I've been working in this office that I have been, like, Dr. Taylor, the doctor that works here, he's been a great, resource every time I've had a question that, he'll try to help, answer it any way he can. Like, he's always been there to support me. Him and his wife, they're the ones that run the clinic, and they've both been amazing, supportive, you know, business wise, like they own it.
Yeah.
So asking them questions about how to run a business or potentially run a
Mhm.
business, I usually ask them first. And so that has been, very helpful. And just we have a great, I think, relationship between the two of us. So it's been nice.
That's awesome. What would be your best relationship tip you could give our community?
Relationship tip. Honestly, just being honest and like open, um,
Mhm.
being able to take, you know, instruction or criticism in a way that, moves you forward. Um, I think just like finding someone you can really trust and open up to them, and then being able to, listen to what they actually have to say to you as well, whether that's a good thing or maybe something you need to work on. But I think once you have that trust, it really helps, guide you and be able to help you grow.
Mhm. Yeah, I remember when I first met you because I was at Euro Bazaar next door getting some
Mhm,
food and stuff. And you talked about how you ended up in Kennesaw. Could you share? Because that's, I thought, a kind of a bold move is to move
mhm.
into an area that is different and you're not familiar with, you just picked up and moved. Tell our viewers what that was like. What went through your thought process when you made that move?
Yeah, so for those that don't know me, I'm from Kansas, went to school,
Hmm.
grew up in Kansas, went to chiropractic school out in Kansas. My oldest brother moved out here a while ago to go to school, and so we've been visiting, and I knew I wanted to move out here. So he offered me a place to live. I didn't have a job set up when I originally moved out here. I just knew that this is where I wanted to be. Um, and so I had gone through a couple other jobs, like similar to the one I'm in. They're independent contracting positions, so you kind of working out of someone else's office.
Hmm.
Definitely just wasn't really working. Just you know, the just the um, what I'd say, like the office, just space wasn't, where I wanted it to be. So when I found this place, it was funny because I just had walked in, met Dr. Taylor. He was just, like, met me for a few minutes, it felt like, and he was just like, "All right, when do you want to start?" I was like, "Oh, okay. I guess next week if we can." So it was a very quick turnaround.
Hmm.
Um, Kind of just jumped in with both feet and was like, you know what, the Lord will help me, guide me, on this path. And they were both Christians as well, so I knew that was gonna be a helpful thing. So I just honestly just felt natural to hop in here. And then we actually had a conversation about how natural our relationship had been and how
Hmm.
it just felt right. And so yeah, I just kind of jumped in. I'm not very far from where I live, which is great, but yeah, I didn't know anybody here. Um, at least when I first started. Now,
Yeah.
as I've been living here for a little bit, I'm starting to make friends and join the
Yeah.
community and things like that. So that's kind of
Yeah,
where I'm at.
that's really good. I love it that you just picked up and moved and, without a job, just figuring it out. And that's a beautiful thing. What would you say, like, when it comes to the biggest problem from when you started with Dr. Taylor to right now,
Mhm.
what was the biggest challenge that you were faced with?
I think I would say maybe like awareness, just because nobody knew who I was, first of all.
Hmm.
Um, our office space is set up kind of, they had run it through, it's called Disc Centers of America, and it's mainly positioned for patients with disc problems. That's
Hmm.
not necessarily, we still definitely treat those, and we definitely get a lot of those patients in here, but that's not the style of practice either one of us really run right now. And so I think awareness of the fact that some people come in and they're like, "Oh, this is a chiropractic office," or "This is what do you do here?" So people not aren't aware of what we're actually doing here. And then us specifically for me, the fact that I am doing more, the athletes, weekend warriors, soft tissue kind of rehab, things like that. That's not really portrayed right now.
Hmm.
Um, so I think just awareness on that side um, is probably the biggest issue I face at the
Yeah.
moment. And then again, just getting out in the community is really, I've been trying a little bit more, getting my foot in the door of other places, but getting my foot in the door with some of our community members and just letting people know who I am and where I'm at. And,
Yeah.
being a chiropractic town, it's also difficult because, you got chiropractors on, every corner, it seems like. So
Mhm.
setting yourself apart is kind of an important step. So,
Yeah, absolutely. I think I had mentioned to you that, I'm a member of the North Cobb Rotary Club, and
mhm.
there's people that give back, there's people that serve, there's people in the community that are good people, and surrounding ourselves with good people. I would love for you to come and meet some
Yeah.
of these people and see. Um, Tell us, when it comes to the future, what is
Mhm.
Nicole most excited about?
That's a good one. So obviously I'm very excited about just continuing to grow my practice.
Hmm.
Just meeting new people out in the community and just letting them know and trying to bring them in and just really helping them in any way that I can. But I do in the future, I would love to own my own practice and kind of guide it into a more of a sports rehab kind of clinic, as in use my athletic training side as well, where we can be outsourced to schools or
Hmm.
gyms and things like that to maybe give them recovery services or honestly even athletic training services for bigger events, sporting events, and just kind of make it a whole kind of a holistic approach to sports injuries and, not just athletes, but, like I said, those weekend warriors, the people that go to the gym, anyone that's just trying to look for something different.
Hmm. What when you look at solving problems, what has
Mhm.
been your what do you do that works for Nicole? Do you write them down? Do you think about it? Do you journal about it? How does Nicole approach something of a challenge or a problem?
Mhm. Yeah, I do like to think about it. So if I can't give a patient or a client something right then, and usually I like to tell them like, let me research this, let me look, see what I can find, and let me come back to you with a better answer. So usually I like to just, go to research articles or, I'm talking to other doctors, Dr. Taylor, like I said, I go to him for things if he knows answers to. Obviously, I have other chiropractor friends from school, so sometimes I'll occasionally reach out to them, see what they think. But mostly, I feel like it's just doing my own research, just trying to find what I can for them, and then, you know, come to them with some options of whatever the problem may be, some
Hmm.
solutions that might help them. And, you kind of sometimes you have to start down one route. If it's not working, you got to go down the other route and see if it works that way. But just being open with the patient, I think, is helpful, letting them know that, like, it may not work this way, but we can definitely try something else. But let's see what we can do for you and help you.
Hmm. That is awesome. As we look at a community that we live in, which is the Kennesaw community, what does community mean to you?
Community is very important, especially coming from I grew up with lots of friends and family around. So moving out here was a little bit like, oh, who are my friends going to be? Who's my community going to be? I definitely found that obviously through my church, and like that is a huge part of like how that's helped me, cope with being here and just
Mhm.
having a good relationship with them. So, but, in a community where you're working, that I think that is also very important to help support the people around you, the other businesses that you may be working near. But just getting to know the people in your community and like different ways that you might be able to help them or support them. I do think that's really important.
That is so good. Yeah. Besides your Bible, what has
Hmm.
been a book that you have read that has made an impact on your business career?
Mm. Oh, I don't know if I even remember know the title. Um, Honestly, I don't know that I have one that I remember.
Yeah.
I know
Hmm.
that we read so much through school that I know that
Yeah.
that's really helpful, but I personally can't just think of one off the top of my head right now.
Awesome. What would you say when you look at the next year and
Mhm.
how things are moving very rapidly? How do you look at what is happening in the world today and what Nicole is doing to prepare for the next year?
Um, hmm, Good question. Yeah, so I think, just staying connected to who you are as a person is gonna be helpful, and
Mhm.
just, um, the fact that, like, for me, like, I truly just wanna help people any way that I can,
Mhm.
and just being able to do that through chiropractic care within the next year, the way that things are going. I think just keeping an open mind, keeping an open, communication, and just allowing people to trust you through their care is helpful. And then hopefully, that'll just be like a place, I guess, where people just feel comfortable and at home and can trust
Yeah.
you. And just, sometimes you kind of become a psychologist in a way. Like, people come in
Mhm.
and they need to share their problems. And I know that, when things are going on in the world, even if you don't agree with them or whatever it may be, just being someone that they can talk to and kind of bounce their troubles off of you kind of helps their healing journey as well. It kind of de-stresses them and can help them, you know, move on and feel a little bit better maybe that day. So,
Oh, I love that. I want to be respectful of your time, Nicole.
Yeah.
So tell our viewers if they want more of Nicole and they want to know more, how can they get a hold of you to be able to support you in your journey and for them to get the services that you provide at your clinic?
Yes. So right now we're gonna still be having the same um sorry, website. That's what I was trying to think of. The website. I am in the mix of making a new website with like a new name for myself.
Okay.
But that probably won't be done in a while. So as of right now, it's still Disc Centers of America, Kennesaw.
Okay.
Um, I can look that up because I honestly don't remember exactly what it's called.
Well, we'll do this. We'll put it in the
Put it
show
in our show
notes.
notes.
Yeah,
Okay.
because this will
Yeah.
be live next Monday. So
Next Monday.
we'll
Okay.
make sure that Rolando, we get a hold of you to get all that information for people to
Yeah.
get a hold of you.
Yeah,
And we'll
so my
put it in
website would definitely be the
the-
best option because you can, schedule
Okay.
online, you can read up my bio. We've got the phone number connected to that as well. I also have a social media page that I'm trying to be a little bit more active with on Instagram.
Hmm.
Um, and I can give you that information as well. But
Okay.
yeah, so those definitely have links to our website with that as well. So those are
That is
probably
awesome.
the two best ways to get a hold of me through
Okay.
those. So.
Fantastic. Final question. What would
Mhm.
be the one thing you would want our viewers to take home from our time on this podcast?
Yeah. Honestly, I think it would just be understanding, what chiropractic care can do for you. Um, and just getting to know me, I guess, a little bit more and understanding who I am and how I might be able to help you and start building that trust with them.
That is so good. Well, Nicole, thank you so much for your time with our community and the time we got a chance to get to know more about Nicole and the work you're doing in the community and the people you're supporting and helping. We appreciate your time and thank you so much for being on the show.
Yeah, thank you for having me. This was great. Really appreciate it.